And so without further ado, please help me in welcoming our panelists. Our first one is Miss Amanda Butterfield. She's a beef producer from Pennsylvania. Amanda has been at the Antibiotic Symposium before. She joined us last year as a beef producer guest, and she also had the opportunity to go in March to the Centers for Disease Control as a part of a program that was funded in part by the Beef Checkoff. And so we'll talk a bit about that with Amanda and hear beef producer views. Another interesting thing about Amanda is that she's not only just a beef producer, she's a mother, and she works for a large drug company. And so I think that's a really interesting season. Oh, a feed company. Feed, nutrition, all of those beautiful things, right, that we use to keep our animals healthy. The next person that I'd like to welcome to the stage is Mr. Sean Stapleton. He is a veterinary medicine student from Cornell University up in Ithaca. And Sean is somebody who I think is really interesting, because he's made this choice to go into a field where we heard even just yesterday that it's hard, there's an opinion that it's hard to attract really great talent, especially in the large animal areas. And so we can talk a bit with Sean about that. And also I think it's really interesting because he is engaged in some antimicrobial resistance research right now at Cornell, so he'll speak a bit about that. The third panelist that we have is Miss Elise Wade. She is a communication marketing person from Oklahoma State. And you may have, if you are a football fan, you may have seen Elise charging down the field last year as the OSU Spirit Rider. And Elise is somebody who is an influencer. That was a term that we heard yesterday as we were talking about communication, like how do we engage these influencers in the conversation. She's also somebody who just loves the Western way of life and has done a lot to represent what happens in agriculture, and so she can speak a bit about that. And ultimately, she's a TV personality, and so you see her on TV with bullfighters only and a lot of rodeo activity, so we'll hear from Miss Elise Wade. And our final panelist, who was our late ad, and I was so excited when I got the message from Connell. He was like, I can actually be there. We went back and forth for a couple of weeks, and his company is going through all sorts of fun growth. And I've got Mr. Connell Gould. He's the Director of Procurement for HelloFresh Canada. And I met him a couple of weeks ago when I was in Calgary at a Canadian Roundtable for Sustainable Beef meeting. And I was really curious because HelloFresh, to me, seems to be a very millennial-focused organization. They have a food delivery service where you get everything in the box and you can cook this delicious meal. I've used HelloFresh. I think it's really interesting. And so as I met Connell, I was like, tell me more about what you're doing in the millennial market that you're serving and all things HelloFresh. One interesting thing about HelloFresh is that he represents Canada. They've got a U.S. market, and they have now just expanded into Europe. And you can talk a bit about that. So all sorts of awesomeness on this stage this morning. Please use Slido if you've got questions, because we will have time to engage the audience. And so if there's that burning question you have for a vet student or somebody who is in the world of social media, an influencer or beef producer, somebody who is in there making decisions about the kinds of meats they're going to put in their processes, you've got them all right here. So I would like to open up the dialogue this morning with just a bit of background and a little bit of perspective on how each of these individuals are engaged in antibiotic-focused conversations on their daily kind of routines, right? Whether they're in school or they're in the office, just kind of what does antibiotic conversation look like? So, Miss Amanda, can you start us off? How often are you touching antibiotics in your daily life? What's the story?
Actually, we have about 60 cow-calf operation, which is we take care of the mamas, get them pregnant. They have calves. We raise them up to about 600 pounds, and then they go on to the next process. So we don't really touch antibiotics all that much. In fact, when I went back and looked at all my herd health records since I started my herd in 2006, I put some numbers here. That's why I have my cheat sheets here. So the 57 cows that I have, 37 have never seen an antibiotic, and their average age of life is 6 years of age. So out of that, there's 222 years, and I treat a cow every 11.1 years, according to those metrics right there. So me, I'm a very healthy person. No, I don't have any diseases whatsoever that I know of. But once a year, about 1.2 times a year, I get on antibiotics for bronchitis, sinusitis, and products like that. So looking at my cows, the overall herd health of my cows is a lot less than I thought after I did these numbers, which kind of surprised me as well. And those cows that were treated for pink eye, foot rot, in conjunction with our veterinarians. And we always pick up the phone and have thoughtful conversations with veterinarians and our staff and have these discussions prior to injecting, because we want to make the correct choice, because there are consequences at a large cost to using antibiotics, because we want to use the best antibiotics and they're usually the most expensive.
Awesome, thank you. So you ran the numbers and it was shocking to you that it was so little?
Yes, because the few times that you remember treating a cow, they're not very sometimes easy to handle. So they're vividly recalled in your head when they're charging at you in a chute. So you feel that they're treating them a lot more. But when I ran all the cow cards and everything, it was very interesting to me that we did not use them. And I'm usually more aggressive at treatment because, as an animal welfare perspective, I want to make sure that my cows are well treated and that they're happy, and I don't want to see them suffer if they are engaged in any kind of disease that I can treat with antibiotics.
Nice, thank you. All right, Sean, as a vet student, how often are you touching things that are resistance antibiotic related?
Well, so far, most of my day, the better half of my day, probably 4 to 8 hours, I would say, is in the lecture hall. So I'm not touching too many, infected animals yet. I start clinics in a couple of months, so that will definitely change. But, the conversation is still there, and that's not because that's the topic of the research that I work on. As I'm sitting through these lectures, it doesn't matter if it's, related to food animals, whether it's a small animal surgery lecture. Just the other day, we were talking about canine encephalitides, and a couple minutes were spent, the neurologist, talking to us about antimicrobial stewardship. This is something that comes up, I would say on a daily basis, and it's also outside of the classroom, something that I talk with my friends and family about, because they're invested. They want to know more, and that's not something that I can say for really any other aspect of veterinary medicine in my experience. This isn't something, or there's nothing else that I can really compare that I talk regularly about with, the public I see on social media. And then just to turn around and come and talk about it with my lab, to talk about it with my classmates on a daily basis, it's really reliable.
Nice. And something interesting, you talked about the small animals. What did you think about the dog conversation yesterday? And that's the companion animal piece is really interesting, right?
Definitely, and I had talked a little bit about that with Dr. Goodman before coming here, and that is something that people definitely don't think about, is that we're also prescribing antibiotics to our dogs and cats, and that they're also part of the conversation. Like, we have to think about antimicrobial use in that area just as much as we do with all of our food-producing animals.
That's right. They're crawling into bed with you, all sorts of fun stuff. Awesome. Well, thank you so much for that introduction. Elise, tell us about your life as a college student, as somebody who's out there on social media having all sorts of conversations. How does this topic touch you?
I am a human. I eat food, and one of my favorite quotes is, if you eat, you are involved in agriculture. And so I am. So I'm in contact with antimicrobials and antibiotics and whatever on a daily basis. My mom is a doctor. I'm very open to hearing about the medical conversation, and my grandpa has a small cow-calf operation, and I'm around rodeo and all these things. And at Oklahoma State, I've been very close to it, and so it's a conversation that I want to hear more of. I'm not so educated on it. Everyone here, you have so much more education than a lot of people that are just like me, but as a millennial and as someone that's not, I'm curious and I want to know, and I'm here to learn as much as y'all are at the moment. So,
some quick additional question. As you told your friends that you're coming here to talk about antibiotics and antimicrobial resistance, what was their reaction?
They were curious. actually very interested. And I'm like, you know what, I don't exactly know what I'm going to hear when I get there, but people want to know how to continue this conversation. And I would tell my friends, you all want to know how to get people like me interested in what we're talking about, because it needs to be talked about. If it's not, people have an open door to have miscommunication and undereducation. And so my friends are pretty interested in it, and I actually posted this morning at 6:30 that I was doing this, and between 6:30 and now, I've had about 7 messages from people saying, wow, that's so cool, or wait, what are you doing, or what even is that, what are you going to do there today? And I think that that just shows the power that social media has, and people like myself, that I don't talk about it every day, so they're interested in hearing what I'm about to be doing, because it's not common in our everyday life, or they don't realize it is.
So one of the words we could have added to our screen is curious. So a word that describes that typical millennial, really, really curious. I like that. Awesome. All right, Connell, tell me about your role, Director of Procurement, HelloFresh Canada. How often are you talking about this?
Yes.
There you go.
Wow. Yikes. It's really early for a millennial panel, isn't it?
Right?
So we're talking about it. We're talking about it every day because we're dealing with a group of consumers for whom this is an extremely meaningful topic. And so, thanks for the quick intro on HelloFresh. One thing that I would say to describe HelloFresh, as an employee there, is that we're an extremely data-driven organization. So we actually collect over 500,000 data points on people's preferences on ingredients and recipes every week. So we have the world's largest food preferences database. And we've done a lot of research specifically around claims on proteins that underscores raised without antibiotics is something that people really, really, really care about. So among other things, of course, but it's at the top of the list. So we're talking about it every day.
Every day. So the largest database? That is impressive. What's driving HelloFresh to care so much about that data?
I think it's a cultural thing within the organization, but we're very, very close to our customers. And I think that's really exciting for our suppliers because it means that we can give them very immediate and very direct feedback on their products within days of them delivering their ingredients to us, and then we can turn around and say, this is what people are saying about your products. So there aren't many channels that can do that, and that's a huge value proposition to our suppliers. And then on the other side of my role, as head of procurement in Canada, I'm dealing with our vendors every day and talking to them about how we can co-create a better food ecosystem and sort of plan for the future around building the necessary supply base to support our pretty extreme growth in Canada.
Awesome. All right, so I'm going to stay there with you, and I would love for you to tell us, why do you think that we've got this mistrust between millennials and food producers? At least that's my assessment, is I don't understand what you're doing, I don't know if I like what you're doing. Why is that such a big deal today?
Yeah, totally. So I think I got three reasons here. I think reason number one is just lack of transparency. Food production in general is such an opaque industry, and I think meat production especially is a really opaque industry. And I can say this because I work in food sourcing now, but I come from a career in sourcing and supply chain in a completely different industry. I've only been at HelloFresh for 2.5 years. The company's only existed for 2.5 years. So I still have a lot of that outsider's perspective, and I remember what it's like to be a consumer without the insights into what's going on in food production and how everything comes through the value chain to your plate. So I think lack of transparency is a big one. I think number two is control of the narrative. I think that most of the public story around beef production is told by journalists who are focusing on a pretty narrow slice of the entire industry. And so it paints a fairly extreme picture, and I think that there's a lot that the beef industry can actually do to tell their side of the story, but the challenge is to do it in a way that doesn't come across as defensive, right? And I think that is a huge challenge, and I don't really have an answer on how to do that today. But And the third thing, I think, is that there's a real lack of a defined middle ground between, you have these two extreme ends of the spectrum with, never ever antibiotics and, everything else. And in reality, it is a continuous spectrum, but there isn't clear definition of what is in the middle of that scale. And I find it really interesting, especially working at HelloFresh as a global company, where we operate in 11 countries around the world, a lot of European markets, Australia, Canada, the U.S., and this never ever antibiotic standard only really exists in North America. And I think that's fascinating, because it seems to me, when I look at the market, a reaction to the public perception of what was going on, of what was the conventional production system, and the pendulum always swings the other way. So
you just said something that's really interesting, and something that came up yesterday, that the pendulum might be swinging the other way, right? Because there was a prediction, perhaps, that we might see less claims of, antibiotic-free, those types of things, and so it might come back. Do you see that happening in this space?
Yeah, I mean, and I'm sure we'll get into this in more detail later, but I absolutely think that there is room for more clarity on and transparency in what's available to consumers, and there aren't only two options. And so with the extremes, or the apparent extremes from a consumer perspective of no antibiotics ever, and then the opposite has got to be antibiotics all the time, it sort of forces people's hand a little bit.
Great. Amanda, I want to hop over to you. Why do you think there's this mistrust?
So thank you for that. Again, I'm going to defer to my notes. So I'm an older millennial. I'm right on that borderline. And my husband is 4 years older than me, and he does not own a smartphone. He still is an old school flip phone. So when he and I, when we're doing, have a question, shoot side of the cow, I'm like, we'll just bother the veterinarian. I'll text him. I'll Snapchat him. And our veterinarian's younger, so he does that. But my husband's like, no, don't do that. So I think that when we talk about some of this stuff with social media and technology, and knowing the age of producers out there, it's around that 55, 60-year-old cusp. I think that they're afraid to bother people and ask questions and information to make these right decisions with everything like that. So I'm not afraid to jump on social media. I'd be like, we'll Snapchat the vet. It's all good. I'll take a picture of the cow, like, look at this tit, like, what do you think is wrong with this? And my veterinarian rolls his eyes at me, but he's his younger generation of producers that are coming on board to start to do this too. So social media and the 1% and using the use of technology is something that I feel that is helping drive some of these conversations. But one thing back to Colin is that I feel that sometimes food companies are driving labels. Because I'll walk into Whole Foods, and I live in the middle of nowhere, so when I do get an opportunity, I try to go to Whole Foods and some of these more progressive, I don't know, lack of better terms, non-conventional grocery stores like what I grew up in the 80s with, and look at these labels, and I'm confused. And I'm like, I raise these cows, and I know exactly what it is, and I'm like, I don't even know where my cows would fit in some of these labels. So, and I think that there's a competition even within the retail level of what our food labels are, and it's like that keeping up with the Joneses, like, well, we have this, and we have this, and that's very confusing to consumers. I mean, it's confusing to me as a producer, let alone as a consumer. So between the influx of always having to have your cell phone ready to go and have social media and trying to weed out the screaming voices on both ends and all the labels, it's very confusing out there to try to disown some of that information. And another thing too is, as producers, I am not from a farm. I was raised in Pittsburgh, so if you could tell my accent, go Stillers, that's kind of where I grew up. And so when I married into ag and invested my career in there is a very unwilling trust of older generations to open the farm. And I've seen people taking pictures by my farm sign. I'm like, hey, come on up. Let's see my cows. And I have a pet cow. We have running around, a steer running on our property, and everyone thinks it's silly in my community. But I'm like, people want to engage. They want to feel animals. They want to know that we take care of them. So I have Chuck the cow that my daughter raised, and he has a collar, and she puts glitter nail polish on him. And we open our farm up and made my husband very uncomfortable because he's more of the Gen X generation. But we need to open our farm farm door, and slowly we are doing that. But again, as these younger generations are coming on board and having these discussions, that it's changing.
How fun is that? I'm going to make it a really easy in, right? I'm going to start the conversation. I've got my pet cow here. He's got the glitter hooves, but this is the thing I'm accessible. Let's start the dialogue. I think that's really cool. Thank you, Amanda. All right, Sean, what are you going to add to the dialogue here? What is causing the divide?
Well, you don't want to point to one specific thing, that this is the reason for mistrust. But, one of the first things that comes to my mind is, every so often there are these films, documentaries, whatever you want to call them, that come out on platforms like Netflix, and they have a pretty lasting impact, it seems. People watch those, and I would say for a large majority of our generation, as has already been mentioned, they've never seen a food-producing facility. They've never even been on a farm. And if this is the only window that they're getting into the food-producing industry, it's not painting the prettiest picture. And it's using, they use evidence. It's not just appealing to the pathos, it's the logos as well. They cite scientific evidence, they show video after video, and for some people that's all that they have to grasp onto. And I wouldn't say that it's necessarily, the use of antimicrobials in food producing either. The concerns when people watch these videos and sort of decide that they're switching away from meat-based diets, it's not just because of how antimicrobials are being used, even though we all recognize that's definitely a significant issue, but it's also, the animal welfare concerns, the concerns of how food production has affected the environment or uses resources. Even most recently, there's a perception, that eating meat could predispose you to cancer. Like, there are all of these ideas that are being perpetuated through journalism and are easily accessible, and it's really easy to, gain a negative picture when that's not necessarily the case.
So the solution I hear perhaps is we need our own documentary on Netflix. What do you think about that? I hear that all the time, and I don't know if I agree. What do you think?
I would say, why not? Why not have, another side of the narrative that people can see? It is sort of a far cry to, bring all of these millennials onto the farm. Like not everybody is going to be willing to do that. Not everybody has the time to do that. So why not?
Oh, I like that. Cool. All right, bring it home, Elise. What are you going to add to this dialogue?
Well, I'm going to make it a little personal at this point. Like I said, my mom's a doctor, and as a lot of you know, you have so much information in your brains right now. You know all of these things. You know so much about the industries that you're involved in, and you can't unknow what you know. My mom is a doctor, and in tough situations that you have to explain to people that don't know, it's hard to break those things down sometimes because you can't unknow that, and you know what's actually going on, and especially like in cattle and in animals, you know what's actually going on, and a lot of people don't, and that's like me. Because you can't unknow what you know, I can't know what I don't, because it's not being talked about. It's not open dialogue, and any time that I've heard the conversation about any of this, it's usually people being defensive or on, like you said, opposite ends of the spectrum, defending, oh, well, our cattle need antibiotics and they need treatment for X, Y, and Z, because it's just like giving medicine to your kids. You take care of them. This is our livelihood. They have to have it. But you're not talking about it on a daily basis, and it's not around the people that, like me, I know who I can turn to as like vets and friends and other producers and like people like Sarah that I know I can go to because, like I said, I'm curious. But I don't know these things, and sometimes it's hard to ask the questions that you don't even know you don't know.
And knowing you might get well, why are you asking me this? I'm doing the right thing. Don't be defensive.
And like you were talking about with Netflix and things like that, being able to reach out to people, where are the demographic that you're wanting people to understand? At this age group, yes, you all have had the background in it, you're interested in it, it's your world. But what people don't understand, like in a regular college campus, a lot of people like me, I mean, I understand it because I'm in the industry in a way, but they don't know that they need to know that. They don't know that it's a conversation that can be talked about. And when they see it on social media, it's typically negative. It needs to be pushed out there, the positives of this, in a non-aggressive way, rather than throwing out all these big words like antimicrobials and antibiotics and blah, 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 all the big smart jargon that we don't understand. It's intimidating, and I'm intimidated by it, but I'm curious, I'm here. But people like me that don't know, you can't figure it out because you're like, there's so much information I don't understand. And it's hard to be able to kind of break that down because you feel like you're going to get jumped on and have an aggressive person in your face going, well, this is why we have to give it to our animals and they have to have it. And I'm like, I just wanted to know what happens on the farm.
Right. Right. I didn't want to get schooled here. And, good. Awesome. Well, I think that we've opened some good ideas here, and now I've got some specific questions for each of you. So, Amanda, I know that you've got a really interesting view because you got to go down to CDC in March and have the chance to hear from the folks that are talking about this topic, whole genome sequencing, all sorts of fun things. As you walked away from that experience, like, what was the biggest thing that surprised you?
So there's two take-home messages that surprised me the most. One was how disengaged the CDC was with what we do on the farm. But on a flip note with that, that resonated with me, but we're changing that, and we're having bigger discussions with that, because we need to be out on the farm. And then on the flip side, we need to know what the CDC as producers are doing for us and are doing there, and they're doing tremendous work. The way that they monitor diseases, I don't think that the common producer knows what the CDC is doing to protect us from diseases that can come back and come to the United States and just cause huge economic ramifications for us and our personal lives too. I mean, if foot and mouth disease came to the United States, it would just be devastating. Personally, because I really wouldn't want to see all my cows euthanized if it hit. And economically, I mean, how would I rebound from that? I don't even know if my insurance company, quite frankly, would pay for cows like that. And that brings another question I should probably ask. But one of the bigger things is that Dr. Megan Nichols gave a PowerPoint presentation about some of the disease connections that we found and how much we're lacking on traceability. So we infected some people with Salmonella Heidelberg, and a lot of people got sick, and how it was so difficult for them to trace those animals back to the farm, and it wasn't even making someone culpable for what they were doing. There was kids that got sick, and potential farm people or employees, and I mean, looking from a personal perspective, you don't want to see anybody get sick, but then now looking at the other ramifications of liability. So I was at another meeting a few weeks ago, and if I contaminate someone with my food products, they don't even have to prove in court that producer purchased meat from my farm or traceability. I could still be culpable for that. So there's a lot of economic ramifications for me, and taking emotions out of it about people getting sick. So that's something that really resonated with me, was that PowerPoint presentation, and how as an industry we need to really step up and have these tough discussions about traceability so that we can not necessarily make somebody liable for something, but have these conversations to prevent people from getting sick. So, and also the technology that's coming to fruition, and a bigger conversation needs to happen. All the technology that they have there, how can we make it 24/7 accessible and get it to the farm and get it to how we can make that technology and that information utilizable in a minute. So one of the things that I do have as a millennial, I want to know now. I don't want to wait 10 minutes. I want you to answer your phone. I want you to give me an answer. And so I think that we still have some time lag from what happens onto the farm to get that technology and to make it interpretable.
Nice, nice. It was so cool to just observe that connection between beef producers and CDC, and just the overall curiosity level that was there, and just the intention to want to get better and to engage more and to be there together. It was really, really cool. So thanks for sharing that, Amanda. As you kind of put your magic ball to work and kind of look at what you see happening in the future with drug companies, with what's happening with nutrition, all of that, like what do you see? What are the trends?
A lot of preventative medicine. I work for Cargill now. We have a team that we're looking into micro ingredients. So how can we feed products at a micro level, non-antibiotic, to prevent medicines? And we touched upon that yesterday with probiotics, prebiotics, and those conversation. But there's also linoleic acid that you could feed to calves that the Holstein cow is now deficient in. And how do we prime the immune system with that? And it's taking it to the next level. So it's not just throwing something in the feed and hoping for the best, but we actually track that published data about how we are affecting immune markers. So there's a lot of those kind of products that are going to be coming out. So as, again, a generation change, instead of going to the syringe to stop or help an animal that's sick, we're looking at how do we prevent that disease from occurring, but still have our toolbox to go to it, because there's always a disease outbreak that you need to go with an antibiotic. But looking at different ways of feeding those kind of animals, preventative medicine, well thought out, going and looking at some of these needs. And with new technology coming out, we are able to identify some of the epigenetics that are going on inside of animals at a very small level, and how we're influencing their immune system at birth. And I think that's really cool that we're going through, and actually Cornell's leading the path, I think, on some of the epigenetics. So I think that some of those new tools that we're coming out with and looking at a different way of handling our animals, that's something that we're definitely on the cusp of.
It's all about proactivity, right? I love that. So let's now talk about the veterinarian side. I'm really interested, why did you choose this path, knowing that there's a lot of pressure, right? You're the one that has to have the dialogue with the producer a lot of the times, right? You've got that veterinary-client relationship. You're the one that, has to, deal with the issues when the animal's sick. Like, that's a lot of pressure. So why did you make the choice?
That's a good question, and I definitely consider that on a daily basis as I'm trying to get through my veterinary curriculum. But when I was in undergrad and just sort of thinking about, where I wanted to go, I was really interested in human medicine from the beginning, but also interacting with animals. And, veterinarians fall right at that intersection. So it sort of became a no-brainer decision for me to enter the veterinary field, because that's where my interests were. And as far as getting involved in antimicrobial use and resistance research, that was honestly just an accident. I was looking for opportunities to become engaged in research, and I sort of fell into the hands of Euro Groen, who is an epidemiologist at Cornell. And he had a project that was just getting up and running related to antimicrobial use and mathematical modeling. And so what we've been doing is developing a mathematical model that assesses how the use of antimicrobials in beef cattle can lead to the dissemination of antimicrobial resistant bacteria and resistance genes from the feedlot. And then using those same models to sort of assess intervention strategies that might mitigate the dissemination of resistant bacteria. So this project is, an overall small branch of a much larger project spearheaded by Morgan Scott at Texas A&M. And we're really approaching this with One Health in mind. This isn't a project that's looking at it from the individual cow level. We're thinking about populations of cattle, how they're interacting with their environment, and how the humans can shape and mold that environment. And I think at its core, that's One Health. And it's really attempting to come up with solutions to this problem that engage all stakeholders, that, it's not coming up with an idea that is then enforced or, is required of the producer. It's solutions that engage the producers in a way that they will willfully, help take charge of this problem.
I just have to say I'm thankful for people like you that want to do this and that have followed that curiosity and said, ooh, this is an opportunity, I'm going to seize it. So thank you for doing that. We need it. Cool. All right, Connell, you're up. So I'm really curious, you're not from the industry, right? You've been working for HelloFresh for a couple of years, and one of the things that I loved about you is you said, I get a backstage pass now. I get to go and see what's actually happening. And so you get out on farm, you go to feed yards, you're engaged. What's the thing that you've noticed? What's the, I guess, that thing that you've seen in terms of antibiotics and how we're taking care of animals?
Yeah, totally. Food and nutrition and the science behind it is something that I've been personally passionate about for a long time. So I am truly grateful to be in a position where I can now work on the other side of the industry and have an influence, hopefully. So I have learned a couple things. I think the first one is that antibiotic usage isn't inherently a bad thing, and I know that that's probably extremely obvious to everyone in this room, but I can tell you, myself 3 years ago, even as what I would consider to be a very informed and engaged consumer, didn't really have a clear answer to that question. So, one, it's not necessarily a bad thing. Two is that there is a lot, sort of expanding on that, there is a lot of good stuff happening at the producer level that is in between that, on that conventional spectrum that's not necessarily antibiotic free, but a lot of great, really passionate producers who really care about the health of their animals and the quality of the product that they're putting out that's not really being talked about. They don't really have a platform or a channel or a claim that they can make that's clearly defined in the Canadian market. And I think the third thing, which has been really fascinating for me, is just the economics of beef production. And it's really, really opened my eyes to what it's like to be a cow-calf producer or a feedlot operator, and the fact that it's not, in Canada anyway, not necessarily an extremely lucrative business. And so producers that are using antibiotics to increase their feed conversion efficiency, I can understand it because it's not necessarily like nefarious behavior or anything. It's a lot of them. These producers are it's their livelihood, and they depend on it in order to make a living. So it's given me a lot more empathy and understanding of that side of things.
Empathy and understanding, two amazing things. I love that. So tell us a little bit more about the decisions that HelloFresh Canada has made in the kinds of meat that you source and kind of why you've made those decisions.
So I think one of the reasons that we when we launched in Canada, we made the decision to clearly position ourselves as a premium offering in the market, through ingredient quality and a number of other things. And so raised without antibiotics across all our proteins was one of those pillars that we stood on. And one of the reasons we got behind it, there were a number of them, but one of the most obvious ones is that there aren't many binary standards, right? It either is or it isn't. And so just like organic, that makes it really easy to talk about on a national scale, when you do have a lot of subtle differences in your supply chain across the country, right? So I think, were there more choice in the market? Organic wasn't big enough for us to scale our business on, but we didn't really have any options. We sort of the three options there of organic, raised without antibiotics, or conventional. Another thing I think is that we sort of look at it as a proxy for better farming conditions. An imperfect one, of course, that's why it's just a proxy, but from a lot of the operators that I've gone and seen, those that do not have that do not use any antibiotics or growth hormones in their operation, they tend to rely on other things to improve animal health, like better stocking densities and better feed. And the third thing is, I think that we've just found phenomenal partners in that space, and people who are really aligned with our values and committed to growing this business in Canada, and they've been excellent, and they've scaled with us as we've grown. I think on the producer side, in terms of how this was received, it definitely met with initial skepticism in the market, but since then our crazy hockey stick curve-like growth has really gotten people to rally around the concept, and now we have producers approaching us all the time saying, we'd love to be a partner, can you help us convert our flocks, or can you help us convert our herds to be a fit with your program? And
the producers approaching you, saying, help us.
Absolutely.
Wow.
Yeah. So, and so we've been lucky to do some pretty amazing things. I think on poultry, we've effectively helped double the size of the raised without antibiotics market in Canada through working with our producers to help convert their flocks from conventional over to RWA. A lot harder to do that on cattle because the life cycle of a bird is 8 weeks, and for a cow it's 2.5 years. So we would have had to get starting before we even launched in Canada. So I mean and now we're growing faster than the market in Canada, and that's a really interesting challenge that I definitely didn't anticipate we would face 2.5 years ago.
Wow. Thank you. All right, Elise, one question for you, and I think it's one that everybody wants to know. Influencers. Why are they so important? Who are the key influencers we need to be engaging? And just, tell us, what do we need to know?
That is a very tough question. But when hearing everyone up here talk a little bit, something that one of my professors said on the very first day of class was that on average, so everyone in this room and here today, and all of us, you are an average of 2 to 3 people away from someone that's met the president. And that blew my mind. Like, gone completely. It didn't make any sense, and everyone was like, how was that even possible? But if you've ever been somewhere to like a parade or something and gotten to shake hands with someone that became the senator or the governor, chances are they have been to Washington, D.C., and they've gotten to shake hands with the president. There you go. That's 3 people. And that's your middleman. Here, we're lacking a middleman. The conversation's happening here. I didn't know that this was being talked about. I'm learning things right now that I have no idea that I even wanted to know. But now I do. And it's information that I'm taking in. And so there's that middleman that's not there that is being able to kind of translate between the 2 people, the uneducated and the people like you that are, that can break it down in a way that's interesting and that they can kind of have a more broken down and understandable way of learning this information. And so as an influencer, something that I could get called as, like in the Western industry, people are listening to what I'm saying, and people are listening to what you're saying. If you were able to touch base on social media, like you talked about with Snapchat, you're communicating with people. And every day that you're even opening the conversation as an influencer, you just add it into the conversation. And like Sarah, when we were talking about earlier, last night I went and was getting my hair done. My hairdresser, she's from Wisconsin. That opened the conversation about cheese, and she said that she actually worked in a dairy barn growing up. And I said, really? Okay, well, I just have like a question then. I've seen like the calves, like they kind of have them wearing those collars and stuff when they're real young. Like they look like newborns to weanling age area, and they've got like these little dog houses. Why can't you just kick them out in the pasture? And that open dialogue to be discussing the health reasons for that, and that they can get better food and the nutrients that they actually need. And that's just something that I didn't know and I wanted to. And she was able to break that down. That was my hairdresser. She was able to break that down to me, and then she influenced me. People like that have been in the industry and are talking to anyone. I'm going to go back to school today, and people are going to ask what I did. And I get to talk about what I learned. That's why being an influencer is so important, because it's the middleman between the educated and the people that don't even know that they don't know.
And do you get paid?
Do I get paid?
Yeah, as an influencer, because that's always a question. They're like, all right, so we should use these influencers, and then we go and ask them, and they're like, well, pay me.
Well, it depends. It really does depend on the industry and the company and whatever. I have been compensated for posts before, but I also am very interested in talking about things I'm passionate about. And like today, I'm going to, like I said, go out in the world and be able to talk about this. I'm not going to get paid to go home and talk about what I learned at this symposium. No, because I'm passionate about it, and it's something that I got to learn today. And when you get new information, what do you want to do? Remember in first grade when you started learning the presidents, and you go home and go, Mom, look, I can recite the presidents, and I could do it to song. I'm going to go back to school today and be like, look what I learned today. Or go on my Instagram story and say, hey, this is what I learned today. That's because it's something I'm passionate about. It's something I'm interested in, and it's new information, and I can tell people, look what I know now.
Amen. Look what you know now. Well, and I think I might have lied a little because I said that we would have time for questions, and this conversation has been so good that we are now out of time. But the good news is we capture those questions, and these folks are going to be here for the next 10 minutes while we flip this room. And so I want you to seek them out, ask the questions, engage them online, engage them however you can, because I think that we've got some really great knowledge in this room. Let's share it. Let's give them a round of applause for being here today, being awesome millennials, and thank you.